If you've been cutting things out for your arthritis, nightshades, dairy, gluten, I need to show you where the stronger research actually points. One diet change cut a key inflammation protein linked to cartilage destruction by nearly half in 16 weeks. Not from removing anything, from adding the right things. And look, some of the elimination advice isn't wrong. There are foods worth avoiding, but it's getting most of the attention while the evidence on the addition side sits there largely ignored. Because it turns out there are specific foods, not supplements, not powders, actual food, that measurably reduce the inflammatory signals driving joint pain. And some of them are going to surprise you. We're going to go through the ones with the strongest evidence behind them, not the ones that sound good in theory, not the ones being pushed on health blogs, the ones that show up in clinical research with real numbers attached. And I'll tell you the one thing most people get wrong about turmeric, because if you're already using it, there's a good chance you're not getting much out of it. Let's get into it. The thing most people don't realize about arthritis pain, especially the kind that keeps getting worse, is that it's not just wear and tear. Your cartilage is wearing down. It's just aging. And sure, there's some truth to that, but it's incomplete in a way that changes everything. What's actually happening is that your immune system is caught in a loop. When joint tissue gets damaged, from movement, from old injuries, from the natural changes that come with age, your body releases inflammatory proteins. And these proteins don't just signal pain. They activate enzymes that actively break down cartilage. So the inflammation isn't just a symptom of the damage, it's accelerating it. Think about it this way. If your cartilage were a wall, normal aging would be rain slowly wearing it down over decades. Chronic inflammation is someone chipping at that same wall with a hammer every single day while the rain is still falling. So what does that have to do with what's on your plate? Those inflammatory proteins respond to what you eat. Certain foods suppress them, others feed them. And the difference isn't subtle, it's measurable. In blood work, in joint markers, in how stiff you feel when you get out of bed. That's what the research is actually showing, not eat better, feel better in some vague general way. Specific foods, specific proteins, specific measurable reductions. And this is the part that really stays with me, because I see it. Someone comes in who's been managing their arthritis for years. They're on medication. They're careful about how much they walk. They've accepted a certain level of pain as just their new normal. And not one person has ever asked them what they eat for breakfast. Here's what concerns me about that. Cartilage damage doesn't reverse. It accumulates. And if those inflammatory proteins keep doing their job unchecked, 5 years from now, 10 years from now, this is how people end up losing the things they never thought they'd lose. Someone who spent every Saturday morning in their garden, who used to get down on the floor with their grandkids without a second thought, who took the stairs automatically, without calculating whether it was worth the pain on the way back down. And gradually, quietly, they couldn't anymore. Not because of one big event, because of 1,000 mornings where the inflammation kept chipping away, and nobody ever talked about the one lever that might have slowed it down. I'm not telling you that to frighten you. I'm telling you because you're watching this right now, which means you still have time to shift the trajectory. So let's talk about what actually works. The first one is fatty fish. Salmon, mackerel, sardines, herring. The omega-3s in these fish directly suppress the same inflammatory proteins driving cartilage breakdown, and when researchers have measured this in people with arthritis, the results are consistent: lower inflammation markers in the blood, reduced morning stiffness, less joint tenderness over time. Multiple studies show that people who eat fatty fish twice a week, or who take around 600 to 1,000 milligrams of fish oil daily, see meaningful improvements in pain and stiffness. Not marginal, meaningful. Comparable, in some research, to what you'd get from over-the-counter anti-inflammatory medications, without the stomach lining issues that come with long-term use. 2 servings a week, that's the number that keeps showing up. And if fish isn't your thing, or 2 servings a week just isn't realistic right now, a high-quality fish oil supplement hits the same threshold. This isn't a workaround. In the studies where people track their outcomes, the supplement performed right alongside the food. So don't let the food part stop you from getting the benefit. Is fish oil the whole story here? Is it really just one thing doing all the work? No. And this is where the second food becomes important. Extra virgin olive oil. Not vegetable oil, not generic olive oil. Extra virgin specifically. And the reason the distinction matters is a compound called oleocanthal. Oleocanthal works on inflammation through a similar biological pathway to ibuprofen. Actually, let me be more precise about that because I don't want to oversell it. It's not that a drizzle of olive oil is as powerful as a dose of ibuprofen. It's that oleocanthal targets the same enzymes that drive inflammation, which is something basically no other cooking fat does. It's a meaningful overlap, not an identical one. This is actually why the results from a 16-week study out of Anglia Ruskin University are worth paying attention to. Researchers put 99 people with osteoarthritis on a Mediterranean-type diet, heavy on vegetables, fish, whole grains, nuts, and olive oil, for 16 weeks. That key inflammatory protein linked to cartilage breakdown, it dropped by nearly 47% in the diet group. They also saw an 8% reduction in a marker of cartilage degradation. An improved range of motion at both the knee and the hip, 47% in 16 weeks, from changing what they ate. Olive oil isn't doing that alone, but it's a meaningful part of why the Mediterranean diet pattern produces results like that. 2 tablespoons a day as your primary cooking fat is the level that comes up consistently across the research. So at this point, you've got 2 anchors, fatty fish twice a week and extra virgin olive oil as your go-to fat. Those 2 alone start shifting the inflammatory environment in your joints in a measurable direction. This next one is specifically worth paying attention to if you deal with gout or joint pain that flares in sudden, unpredictable episodes, but the mechanism underneath applies to everyone. Tart cherries, not sweet cherries, tart. The Montmorency variety is what shows up most consistently in the research. What makes them worth talking about is a group of compounds called anthocyanins, the deep red pigments that give them their color, which have strong anti-inflammatory effects working on multiple pathways at once. Here's what the research actually shows. In a study at Robert Wood Johnson Medical School, 24 gout patients took 1 tablespoon of tart cherry extract twice a day for 4 months. The result? A 50% reduction in flares, half. And when researchers looked at combining cherry extract with standard gout medication, the reduction jumped to 75%. A separate crossover trial found that people drinking tart cherry juice daily saw their uric acid levels in the blood drop by over 19% in just 4 weeks. And on top of that, a nearly 20% drop in C-reactive protein, one of the most commonly watched inflammation markers on a standard blood panel. If your gout is severe, tart cherries aren't replacing your medication, but as an addition to whatever you're already doing. A 19% drop in uric acid and a 20% drop in that inflammation marker is not a rounding error. That's a measurable shift. And this applies well beyond gout. The anthocyanins in tart cherries, and in blueberries, blackberries, and strawberries too, directly suppress several of the inflammatory signals involved in cartilage breakdown. The same ones we talked about earlier. This is the part most people miss. They think of berries as a healthy snack, and they are, but they're also doing something specific inside the joint environment every time you eat them. A small handful of mixed berries or 8 ounces of tart cherry juice, daily, consistently, is a fundamentally different thing than eating berries when you happen to remember. That's the key. Consistency. These foods work cumulatively, the same way the damage works cumulatively. And there's one more I teased at the top that I need to deliver on. Turmeric. Most people paying attention to joint health have already heard about it. A lot of you are already using it, adding it to smoothies, making golden milk, cooking with it regularly. I don't want to dismiss that. Turmeric is genuinely anti-inflammatory. The research on curcumin, the active compound, is actually quite strong. Meta-analyses of randomized controlled trials show that around 1,000 milligrams a day of curcumin reduces arthritis pain and inflammation at a level comparable to ibuprofen, without the gastrointestinal side effects of long-term use. So what's going wrong for people who are already cooking with it and not seeing results? A teaspoon of turmeric powder contains roughly 200 milligrams of curcumin, and even that 200 milligrams is mostly not absorbed. Your body can't take much of it in before it passes through. The studies showing the ibuprofen comparable results used 1,000 milligrams of a curcumin supplement specifically formulated for absorption, usually with piperine, a compound from black pepper that dramatically increases how much your body actually takes in. So, cook with turmeric. Actually, let me be clear. Keep cooking with it. It adds flavor, it adds some benefit at the margin, and there's nothing wrong with it. But if you're expecting the therapeutic effect the research is showing, the kind that actually moves the needle on pain and stiffness, you need a supplement formulated for absorption. The spice rack alone won't get you there. That's the thing most people never find out. And it matters, because a lot of people are doing the right thing, just not quite enough of it to actually feel it. The last food I want to cover is walnuts. And walnuts specifically. Not just any nut, though mixed nuts are fine. Walnuts are one of the very few plant foods with a meaningful amount of plant-based omega-3. They're also high in monounsaturated fat, and multiple studies confirm their role in reducing inflammation markers. If fatty fish twice a week isn't realistic for you right now, walnuts become an even more important part of the overall pattern. 1 ounce a day, about a small handful, as a snack, on a salad, stirred into oatmeal. It doesn't need to be complicated. And I want to address the flip side briefly. There's one thing worth naming: refined sugar and highly processed foods, white bread, pastries, sugary drinks, most packaged snacks, do the opposite of everything we've been talking about. They spike blood sugar, which feeds the same inflammatory loop we talked about earlier. Processed food keeps that loop running. It doesn't mean you can never eat these things, but if you're adding the right foods and still eating a diet heavy in refined carbs and sugar, you're working against yourself at the same time. The anti-inflammatory foods are turning down the volume on the inflammation signal. The processed foods are turning it back up. What you're trying to do is get the dial consistently moving in one direction. So what does the full picture actually look like? Fatty fish, olive oil, tart cherries, berries, walnuts, whole grains, vegetables. If that list sounds familiar, it should. That's a Mediterranean diet. And the research on the Mediterranean diet and arthritis is the most consistent body of evidence we have on this topic. A meta-analysis that pooled 7 randomized controlled trials, 326 people with arthritis, found that anti-inflammatory diets produced significantly lower pain scores than ordinary diets, not in one study, across 7 independent trials. And this is where things start to click. It was never about any single food doing the heavy lifting. It's the pattern, the cumulative effect of eating this way consistently, over weeks and months, that shifts the inflammatory environment your joints are living in. Here's the thing, that's actually good news, because it means there's no one thing you have to be perfect about. The pattern is forgiving in a way that any single intervention isn't. Miss a week of salmon, skip the cherry juice for a few days. The overall direction still holds if the pattern holds. Pick 2 things from today, just 2, the ones that felt most doable when you heard them. Build those in first, be consistent for 8 weeks, and pay attention to how your mornings feel. The research showed measurable changes at 16 weeks, but people often notice something shifting before that. You've spent a long time managing this. A few consistent additions can genuinely change where things are headed, and that's worth taking seriously. If this was helpful, subscribe so you don't miss the next one. And if you're already doing some of these things, drop it in the comments. I'd love to know what's actually been making a difference for you. Take care of yourself.